Since its independence, Sri Lanka has implemented multiple social protection programs catering to the needs of various population groups. The COVID-19 pandemic and the subsequent economic crisis in Sri Lanka that pushed many more people into poverty have shown that we are all vulnerable to shocks and that social protection is more important than ever. In addition to shocks, we all face individual vulnerabilities over the life cycle. During pregnancy and early childhood, during school age, our work life and when we grow older, and we all have the right to be supported. This right to be supported, the right to social protection, is a fundamental human right that is enshrined in the International Human Rights Framework and Sri Lanka's Constitution. Social protection is also an important means to reduce and prevent poverty and inequality, enhance human capital, productivity, and promote decent work, allow people to seize economic opportunities, increase the resilience of people and society, and promote social cohesion. Social protection is therefore an integral part of the 2030 Agenda for Sustainable Development. Over the past years, the government of Sri Lanka has initiated key social protection reforms to protect poor and vulnerable population groups during times of crisis. Nonetheless, the current system remains very fragmented, leading to large gaps in protection or duplications of efforts. There is no shared vision and strategic framework to ensure that Sri Lanka's social protection system as a whole could live up to its full developmental potential. Last but not least, new challenges to which the system will need to adapt are looming large, such as population aging and climate change. How can we make Sri Lanka's social protection system fit for today's and future challenges? How can we ensure that all citizens are supported throughout their lives when they need it? The Department of the National Planning led the development of Sri Lanka's first national social protection policy, working together with stakeholders across the government, workers, private sector, civil society, and development partners. The policy describes the long-term objectives of Sri Lanka's social protection system, its key components, and the principles that will guide it. It establishes a shared vision for Sri Lanka's social protection system. The NSPP is a common guide and planning tool for all stakeholders to put in place the necessary legal and policy frameworks, institutional arrangements, and operational systems to build an integrated, equitable, and efficient system that provides protection to all citizens when they need it over the life cycle. The social protection system rests on 4 key pillars that complement each other. These are: number 1, social assistance; number 2, social care; number 3, social insurance; and number 4, labour market and productive inclusion interventions. The policy is guided by the underlying principles of equity and inclusion, resilience, coherence in approach, good governance and transparency, cost efficiency and effectiveness, incentive comparability, and sustainability. What is next? Following the policy, the Department of National Planning will work with all stakeholders to develop an accompanying national social protection strategy, which will include an assessment of the existing social protection landscape, key programs and schemes, and specify an implementation plan. Together, we can make this policy a success and ensure that all citizens of Sri Lanka are supported throughout their lives when they need it most, and build a resilient and inclusive country for today and future generations.